Hello and welcome to A World Confined, our show about the global repercussions of the COVID-19 pandemic. In this program, we'll ask, how does war and poverty affect states' ability to fight the coronavirus? And as some countries begin to lift their lockdowns, what happens next? I'm outside the National Assembly. That's the lower house of the French Parliament. Here, politicians have voted to partly lift the lockdown. That means businesses reopening and children returning to school. And one of the big debates here in France is how to prevent a second wave of infection. Now, the answer likely has something to do with testing. And on that front, France can learn plenty from neighbouring Germany, where medics have tested hundreds of thousands more people than they have here in France. From Berlin, here's Nick Spicer.
A temporary testing center in front of a pharmaceutical company in Rostock. Henry Laza doesn't have any symptoms or any sick family or friends, but he'd like some peace of mind. And the COVID-19 test is free. I stick it in here, right? It's easy to get a test. I booked online in a couple of minutes. The company is listed on the NASDAQ exchange, and its market niche is orphan diseases. But since February, 20 employees have been working full out on testing for the coronavirus.
Everything is put into digital format and brought to the lab for analysis.
If Germany is a world leader in testing, it's because of small companies like this one. It's done 7,000 tests in Rostock and 50,000 across the country.
We test personnel in hospitals and retirement homes, as well as firefighters and supermarket employees.
Testing, testing, and keep testing. That's the boss's obsession. At the start of April, he sent out a call to other German firms to switch their production lines to help fight the coronavirus. Some 500 signed up. We had a hard time testing because we don't produce swabs in Europe, he says. We told ourselves something has to change. And change it did. 60,000 swabs are now produced daily in Germany as of last week. We hope for a similar kind of cooperation at the European level, he says. Anybody can do what we've done here in their own country. It's a call on Europeans to start producing at home the medical equipment that is so painfully missing in the fight against the pandemic.
The World Health Organization says testing is vital, but not all tests are created equal. Some are far less reliable than others and are providing false negatives. This appears to be a particular problem at the moment in Moscow, where some 30% of the tests show the wrong results. And the dangers of that are extremely clear, as our Russia correspondent Elena Volonchin has been finding out.
In late March, Pavel Morozov spent 12 days in the hospital just opposite his home. He was diagnosed with pneumonia in both lungs, but not COVID-19.
J'ai fait 4 tests au total. Donc, moi, j'ai eu les résultats d'un seul test que j'ai reçu lorsque j'étais à l'hôpital et en fait qui était négatif.
When he got out of hospital, Pavel got tested again privately. It came out positive. But that means he does not figure in Russia's official statistics of coronavirus cases. And in hospital, he was treated like an ordinary patient.
On était 4 dans la chambre. Lui, son lit était le plus proche du mien. Donc il a eu des symptômes de pneumonie. Il est rentré chez lui dans une région et une semaine plus tard, il y a sa mère qui est entrée à l'hôpital avec une pneumonie.
Unreliable testing is compounded by problems isolating the sick. Dozens of hospitals in Moscow have been requisitioned to take in COVID patients, but they weren't designed for treating infectious diseases. We spoke to a volunteer nurse who works at one of these centers.
Наш корпус – это одна большая красная зараженная грязная зона. Нам выдают один костюм на сутки, но, соответственно, так как у нас шлюзов нет, чтобы выйти покурить, люди проходят костюмы через подвал, в котором люди переодеваются.
Faced with the emergency, the city authorities are building this 800-bed hospital. Part of it is already in service, and according to one doctor who works there, it offers much better conditions.
Оборудована больница очень хорошо, то есть я никогда не видел, чтобы в обычном линейном отделении были прикроватные мониторы.
Will it be enough to stem the pandemic in the Russian capital? The authorities may strike a reassuring tone, but for now, the infection rate is rising exponentially.
After decades of conflict, few countries face greater challenges in the era of coronavirus than Afghanistan. The health ministry has estimated that if lockdown isn't properly enforced, 25 million people could contract COVID-19. And for those who are already sick, they're being treated by doctors who don't have proper protective equipment. From Kabul, Shahzib Wallah and Sonia Ghazali.
This public hospital is deserted, including its emergency ward. Before, hundreds of patients walked in here every day, but a week ago, 10 doctors tested positive for coronavirus, so the hospital is largely closed.
هر فرد یا هر پرسنل صحی از کارگر گرفته تا دکتر تا کلگی سر خود مشکوک هستند.
The coronavirus has opened a new front for the country's healthcare system, which has already been tormented by 40 years of war.
War is a threat. It deviates the resources, the focus. It challenges our logistics and operations. We're concerned not to fill in a gap where we forget the essential health services and focus on COVID-19 only.
The virus has infected nearly 300 health workers in Afghanistan and at least 5 doctors have died. The staff in this intensive care unit is very worried. According to a recent survey, 1/3 of Kabul residents might already be infected by the virus.
In the coming days, we might face a mass cases in Afghanistan, in Kabul, because the numbers are increasing day by day. We are equipped but not well equipped because we are facing the shortage of the tests. We are waiting for the help of the foreign countries, for the help of the WHO.
The peak of the pandemic is expected in mid-May. According to authorities, 25 million Afghans could soon be infected by the virus. That's 70% of the country's population.
More than 1 million people in the United States have the coronavirus. It is the worst affected country in the world. But many there are more concerned with the economic impact of the virus than the pandemic itself. In the state of North Carolina, 17% of the workforce have filed for unemployment, and protests have now sprung up demanding businesses reopen.
We've got to open this country up. The economic devastation is affecting millions and killing God knows how many.
People at high-risk groups, if they should stay home, they should stay home, but the other people should have the choice to work.
I have nothing coming in, no income, no customers, nothing.
It's hurting too much. This is worse than the disease is right now.
It is an instruction we've heard again and again. Wash your hands. But that, of course, is easier said than done if you live in a country with limited running water. Gabon is one of those countries. Now, the government there is stepping up efforts to supply the population with water, but simply there isn't enough to go round. From Libreville, here's Soraya Bakari.
Waiting in line for a few litres of drinking water, it's a daily struggle in many parts of Libreville. Water is scarce in the city of 800,000 inhabitants, but also crucial for hand washing during the COVID-19 pandemic.
On nous demande de laver les mains constamment. On nous a pas distribué aussi ni des gels alcooliques, ni aussi l'eau pour laver les mains. Donc la santé va passer par nous.
This much-awaited tanker truck drives to the city every day. It supplies several areas of the capital where lockdown measures have been eased. The government is behind this free water distribution program as it attempts to stop the spread of the coronavirus. But there's not enough for everyone.
Ils exigent 3 bidons, donc 60 litres par ménage. C'est pas suffisant, 60 litres. Qu'est-ce qu'on fait avec 60 litres? L'eau n'arrive pas dans les maisons. Il faut aller puiser. Il y a des fontaines publiques un peu plus bas et une seule qui n'a que 2 robinets pour toute une cité.
In this area here is the public fountain where JUDICAEL comes every day to fill his water cans. Then he'll sell that water to families already affected by the COVID-19 economic crisis.
Le bidon, quand je fais comme ça, là, c'est 250. Je quitte de chez moi à 10 heures pour essayer de commencer à ravitailler les gens l'eau. Et je peux terminer à 18 heures et quelques, puisqu'il y a le confinement. Il faut respecter l'heure.
Those who don't have enough money, like Alexandre, are struggling to get water at home. He uses his wheelchair to reach the public fountain. Few bottles, barely enough for a couple of days.
Donc voilà comment est-ce que nous, on se débrouille, on se bat pour avoir cette eau.
Only 2/3 of Libreville's water needs are met, the water shortage compounding the ongoing health crisis.
That's it for this week's episode. Let's leave you then with some images of solidarity. People around the world, despite the lockdown, finding creative ways to thank doctors and nurses. Thanks for watching and see you next time.
It was one of the most striking signs a crisis was unfolding. On one side of the chain, farmers' heartbreak as harvests never left the farm. On the other, supermarket shelves stripped of essential supplies. In a matter of weeks, the coronavirus had exposed the fragility of our global food system, a system that survives on a razor's edge. COVID-19 won't be the first or the last crisis that the world faces, but is it the wake-up call needed to reform the way food gets from farm to fork? That's this week on Down to Earth.
Down to Earth, presented by Mairead Dundas on France 24 and France24.com.